Pathways Oral Systemic Links with Pam Cushenan. We're super excited to have you here. We're just a minute early. We would like you to be sure you have the handout. So please tap on that red banner at the top of the screen, or you can check your email. It was sent about an hour ago, and let us know if you need any assistance with that. I'm going to put the link in the chat area just in case that banner does not display on your device. That happens occasionally. Again, welcome everyone. This is a very large class this evening, like many of our classes. We're super excited about this. Is a new topic, a new course launch for us over the last couple of months. Pathogenic Pathways Oral Systemic Links. And we're going to start right on time. So be sure you have the handout. Tap on that banner at the top of the screen. And again, welcome everyone. So I'm Dr. Kirsten Rowling. I'm the Chief Education Officer here at Dental CE Academy. And Pathogenic Pathways Oral Systemic Links, this is for one continuing education credit. We are going to introduce you here shortly to Pamela Cushenan, RDH, MS, FSCDH, ABCD. She is an expert in all things hygiene. Super excited to have her on our platform with us this evening. I want to thank ioTech International for the educational support for this program as well. The agenda for this evening, the continuing education course will be for 1 hour. You are required to be here for that hour to get one CE credit live. It is 5 to 6, followed by a presentation by ioTech International on molecular iodine oral care products. So we are inviting you to stay. I have to advise you, it is not required for AGD PACE for CE credit. Following the program, all attendees will be redirected to a screen to complete a quiz. If you would like, you can log off at 6. Again, we hope you will stay. And we will send you a reminder email, at least one, to complete the quiz this evening for CE credit. If you need any assistance, there is a link to reach out to my staff, and they'll be happy to help you. Conflict of interest and financial disclosure is there for you. And it's my pleasure and honor to introduce to you Pam Cushenan. Thank you for joining us all today. She is a passionate health professional dedicated to providing cutting-edge educational sessions as well as connecting care providers with methods to improve the welfare of older adults and older vulnerable populations. She and I have made a real connection about that topic. She is a national speaker, an educational specialist, a researcher, and an advocate for the advancement of access to care options. So Pam, I am going to turn it over to you.
Thank you, Dr. Rowland. This is a great honor to be here with so many of my fellow professionals across the country. And we are going to together explore this incredible topic. In doing so, we're going to be able to describe the presentation of oral health compared to oral disease status. Also be able to discuss how these periodontal pathogens actually interact to create inflammatory issues within the system. In addition, we're going to be able to discuss what are evidence-based causal links versus the increased risk of negative health consequences of different bacteria. And then finally, what we are all very focused on, and our mission is to reduce this pathogenic oral systemic impact. And there are a number of options that we can use to help to do so. So when we're looking at different definitions of what is oral health, versus oral disease. One of the really important organizations in our world is the FDI, World Dental General Assembly. And this organization is worldwide and is very heavily focused in improving the overall welfare of our communities across the world. Their definition is oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. We know as dental professionals, when we have a patient in our chair and we're doing our initial assessments, that gingival tissue, when it's pink and stippled and scalloped edged and knife edged margins between the teeth, that's some healthy looking gum tissue, right? We want to make sure the teeth are intact, that we don't see any active decay, and that we, during our intraoral exam, note no lesions. So when we consider our oral cavity, it is a bacteria factory. Hello, it's warm, dark, it's moist. So there exist over 700 species of bacteria in the oral cavity. Now, that's okay as long as the oral cavity is being managed in a way that the bacterial level doesn't exceed a healthy level. So when things are in balance, it's called symbiosis. And that means there's normally a higher percentage of gram-positive than the gram-negative bacteria in existence there. There's a number of gram-positive and gram-negative bacteria listed for you. And again, we want to see more of the gram-positive than the gram-negative in our patients that in order for them to exhibit oral health. So we're going to go from what's so positive to what's so negative. Well, we have a number of bacteria listed here for you that are going to be seen over and over in research that are actually causing or increasing the risk of and creating negative health consequences, starting with the Porphyromonas gingivalis, PG, Prevotella intermedia, PI, Treponema denicola, TD, Tannerella forsinthensis, TF, Campylobacter rectus, CR, Aggregatibacter actinomycetocomitans, AA, and Fusobacterium nucleatum. That is FN. And again, you're going to see these throughout our presentation because they're being seen so often in direct relation to systemic inflammation and the negative consequences thereof. All right. When we look at these very bacteria that I just listed for you, the most important takeaway I want you to get is that these bacteria, when they are out of balance, actually release inflammation mediators and toxins. These become part of the bloodstream and actually are involved in the systemic inflammation. So these things are seen much more frequently, of course, when chronic periodontitis exists, because they are constantly having issues with this type of pathogenic outcome. So when we look at the disease bacteria side compared to the oral health side, we know that when a bacteria becomes overgrown and there's more negative bacteria, gram-negative than gram-positive, then the mouth is then in dysbiosis, or the system is then in dysbiosis, which is unbalanced and an unhealthy balance. It's defined as a state of community disturbance. So we know from all of the studies out there that you'll have listed throughout this presentation that this is the issue when there's that lack of balance, that we have infections that actually create the systemic responses. So there are keystone pathogens involved. And one of the most common ones that I see in there is the PG. So we'll be talking about that as well. Some of the causal organisms that are listed have been directly related to Alzheimer's disease, cardiovascular disease, diabetes mellitus, and rheumatoid arthritis. They also can co-occur, which is normal actually, with many other bacteria, again leading to dysbiosis. So, why is that so important? Well, we as dental professionals, we're all about that blood-borne transmission, right? We know about what's happening in the oral cavity and how when the mouth is bleeding, whatever bacteria is there, it's throughout the body. That's what happens. However, there are two other routes of dissemination. One is the oropharyngeal, which we often relate to the aspiration pneumonia issue, and the other is orodigestive or intestinal dysbiosis and gut-mediated systemic inflammation. This is often related to metabolic syndrome. So when we look at this particular scheme here, we see that there is a vicious cycle of inflammation going on, whereas there's an increased gingival inflammation, which over time leads to periodontal disease. This is going to release the pro-inflammatory mediators, which then increases that inflammatory state in the system. And that goes into the metabolic syndrome components that we're going to discuss further, which release pro-inflammatory mediators, and you've got a full systemic inflammation. So where the bacteremias or systemic inflammation can really cause issues in the comorbid conditions, you can see, as we mentioned already, metabolic inflammatory disorders such as obesity, metabolic syndrome, type 2 diabetes, non-alcoholic fatty liver disease, and cardiovascular disease. This is one of my most fascinating things I saw was systemic inflammation actually can increase LDL, which is low density lipoprotein, and triglycerides. So increasing that, which is terribly unhealthy, and decrease the high density lipoprotein, HDL. So for those with cholesterol issues, take a look and see what type of oral disease may be existing for those individuals. Also, other direct relations are Alzheimer's disease, inflammatory bowel disease, rheumatoid arthritis, colorectal cancer, and adverse pregnancy outcomes. And I'm emphasizing some of these words because without really looking into systemic issues, I had never even considered colorectal cancer, for example, or inflammatory bowel disease. All right. So it's not only adults that are impacted by oral systemic issues. We have our children and teens also having issues with this. So the two types of hematological disorders that we should be very aware of, and this will be noted in our patients' health histories, is acquired neutropenia and leukemia. Then there are a number, as you can see, of genetic disorders that may be an issue as well, such as Down syndrome, the Papillon-Lefèvre syndrome, the Chidiac-Higashi syndrome, Cohen syndrome, and hypophosphatasia, just to name a few of them. So when we have patients that are children or teens with these conditions, of course, that's a red letter that we need to get on their healthcare team. We are not a silo. We are a member of a very important healthcare team. So interprofessional collaboration is very, very important when these type of conditions exist for our patients. What we are able to do for patients with these conditions and do very well is our routine plaque control, of course, removing hard deposits as well, mechanical debridement, scaling and root planing is needed, soft tissue curettage. We're using a lot more lasers today, and use of selected antimicrobial agents. These are ways to help decrease the impact of these oral systemic issues. Also, when our certain patients have aggressive periodontitis, the prognosis is normally poor, and that will require often multiple extractions of teeth and use of antibiotics. Now, I've included in your handouts 2 really nice charts that you can review. So far as for children and adolescents, we have a chart of what is going to show a healthy bone with their gingival issues and oral systemic issues, and what involves diseased bone. So if you'll note, the healthy bone list includes gingivitis, herpetic gingivostomatitis, HIV, leukemia, mononucleosis, etc. The diseased bone, alveolar bone loss that we would see evidenced on x-rays include diabetes mellitus, Down syndrome, and a number of other ones. So this chart is for you to use. It's got some great information for you to refer to. So moving on to our adult population, which we typically see, of course, the highest level of periodontal disease, we need to note that the health status for adults is not the greatest, especially these days. 6 in 10 adults have a chronic disease, and we have a chart listed there. And 4 in 10 adults have 2 or more of these chronic diseases. So these include hypertension, high cholesterol, arthritis, diabetes, ischemic coronary heart disease, chronic kidney disease, heart disease, depression, Alzheimer's disease, and dementia, as well as COPD. Now, when we look at leading causes of death and disability, you'll see some overlap and some that were not listed before. So there's our heart disease. We see that frequently. Cancer is a leading cause of death and disability. Chronic lung disease, stroke, Alzheimer's disease, diabetes, and again, we see chronic kidney disease. When we look at one of the researchers that I've looked deeply into, actually, Nazir, this individual lists periodontal disease as the centerpiece for all of these different types of medical conditions that we've just mentioned, actually. But that's a pretty serious concern when something that's originating in the oral cavity can have such a direct impact on these different conditions. Now, here is the other reference chart that I'd like you to review in your own time, but it's a really comprehensive view of different oral systemic links and what mode of transmission it is, how it may be actually evidenced in our patient. So take a look at that in your spare time. Now we're going to break down different chronic conditions and look more closely at it and why this is such a big deal to consider it with our patients for our knowledge, as well as helping them to better understand how this is having such a great impact on their welfare. Starting with cardiovascular disease, one of the leading things that kill adults in our country. So 17.5 million deaths worldwide. Atherosclerosis is typically what we see as the primary for this, which is inflammatory vascular disease. Now, in these studies, these very periodontal pathogens that we discussed at the beginning have been identified in this atherosclerotic plaque. Typically, there's a 1.27 times increase in atherosclerosis when periodontitis is a condition for that patient. That's a pretty big deal. We also know that when there's periodontal bacteria causing infection, chronic infection, that there's going to be an inflammatory response that causes ulcerated tissues and can lead to atherosclerotic clotting issues. Why? How? Why do we care? Well, atherosclerosis can lead to the MIs, stroke, and limb ischemia. It involves the medium and large arteries. How does this happen? Well, the endothelial barrier is disrupted. So there's this bacterial onslaught that causes this barrier to be disrupted. There's going to be monocyte adhesion and multiplication or aggregation, promotion of foam cell formation. Foam cells are lipid-filled cells. How unstable is that, right? Fat cells within the artery. Then there's a progression and destabilization of these plaques. Keep in mind, there's fat cells now proliferating in there. Then it can exhibit necrosis and calcification. And now this unstable plaque can rupture and detach and create a clot issue or thrombus. Researchers have detected the DNA of these bacteria that we've already listed: PG, AA, FN, PI, TF, TD, and CR in these atherosclerotic plaques. That's pretty huge evidence. Now, moving on to diabetes. This is another huge condition in our country. There in Georgia, the home of good Southern cooking, there's probably 5 million undiagnosed cases in this state. So you can imagine nationwide or even worldwide. So type 2 diabetes is most prevalent. 90 to 95% of diabetic cases are type 2. What happens there is the pancreas is not producing enough insulin now. Eventually, over time, will stop producing it completely. Then a patient has to go to insulin injections or a pump. The symptoms of a patient with diabetes is polydipsia, polyuria, and nocturia, as well as fatigue, increased infections, leg cramps, paresthesia or numbness of fingers and toes, impotence, and blurred vision. When a patient is diagnosed with a condition, that's usually done through a blood test called A1C, and that is considered below 5.6% and below is healthy. But a patient with 5.7% to 6.4% is considered a pre-diabetic patient. And their fasting glucose is 100 to 125 milligrams per deciliter. A patient that is diabetic shows a fasting glucose level of 126 and higher, as well as an A1C of 6.5% and higher. When a patient has full-fledged diabetes and are on daily meds and or insulin, the desired goal is for them to maintain 7% or lower with their A1C, and they are helped with that through exercise and diet. I had a question last month, actually, on when is it not a good idea to treat a patient based on their A1C. Well, if a dentist is doing extractions, 180 is the breakoff point if you're doing an extraction. A1C, 13, nope, don't do it. Okay, those are the numbers. When a patient is even at an 8% with their A1C, we need to make certain, which we should anyway, have a glucose source available, whether it's orange juice or cake icing or something. One of the offices in the fancy Buckhead area had Dove candies. But anyway, so you do want a glucose source in this situation. Some of the complications that we find orally from uncontrolled diabetes is an increased cavity rate. And that's because glucose is pooling in the oral cavity. When a patient has type 2 diabetes, they're more likely to develop periodontal disease. And also because their immune system is lower and there's poor collagen formation, there's a higher level of tooth loss. Moving on to aspiration pneumonia. This is our oropharyngeal transmission of the bacteria. So with aspiration pneumonia, that means the alveoli are filled with pus or fluid. It's responsible for an average of 15,000 deaths per year in adults 60 and older. Often it's related to poor oral hygiene, dysphagia, and dysphagia. So dysphagia is swallowing disorder that can lead to choking or aspiration. And dysphagia is when the coughing ability is compromised, okay? Either they lose that ability to cough. Anyway, periodontal disease increases the risk of aspiration pneumonia. Why? We'll talk about that in just a moment. But we list the different types of aspiration pneumonia based basically on where a patient is picking it up. One is community acquired, hospital acquired, ventilator associated, and nursing home acquired. So, different things can be inhaled that can lead to aspiration pneumonia: bacteria, fungi, and virus. Bacterial pneumonia, which is the main one we're concerned with in dentistry, is generally the most severe. Viral pneumonia actually self-resolves. So symptoms of patients with pneumonia: difficult or shallow breathing, fever, weight loss, frequent throat clearing, and a productive cough with foul smelling and or tasting sputum. Looking at the individuals that are at an increased risk to that, again, we have our older adults and our young children under 2 years of age, because they have less strength in coughing potentially, or their immune system may be compromised for older adults, for example. If there's a heart or lung condition, a weakened immune system, or neurological conditions like Parkinson's disease, stroke, or dementia, those things also can compromise that patient's ability to cough. And when that happens, any bacteria that's been inhaled or fungi, whatever, if it's not being coughed out appropriately and the immune system's weak, then that infection can set up. And that's how aspiration pneumonia takes hold and causes so much havoc in those individuals' lives. When there are patients that have COPD, they generally have an increased incidence of periodontal disease. So all of this is very interrelated. Now, moving on is pregnancy outcomes. These are things that are directly associated with periodontal disease, and we've seen lots of studies to bring this information. So consider the soft tissue of the mouth, the oral microbiome, the different bacteria that are working together in that moist, dark, warm place. Well, guess what? The placenta is very similar. So these two areas resemble each other, and they are very conducive to bacterial growth. When there's an intrauterine infection, it's mainly associated with Porphyromonas gingivalis, or PG, and Fusobacterium nucleatum, which is FN. These are both periodontopathogen bacteria and obviously a danger to our bodies. I had patients today, actually, this morning, that are trying to have a baby. And I guarantee you that I was discussing with them their periodontal condition. Both are post SRP on perio maintenance, hadn't been in 2 years, and looked like it and assessed that way. And so, and had a couple of cavities each. I mean, it was like, let's talk about how this can impact your pregnancy And you talk about hitting home with patients when they get that, including the husband heard the same thing, as well as oral care for their infant and children. So, I mean, we really have got to, not just us, but doctors, nurses, social workers, everybody needs to emphasize the importance of oral care, oral health, oral professional care, and the importance of it to protecting the health of the infant throughout pregnancy and after. Some of the adverse pregnancy outcomes include maternal infections, preterm birth, where when we have an infant born under 4 pounds, very often there's a hyperactivity or a developmental disability issue that can be associated with that. So it's really, again, these are things to really impress on our potential mothers or pregnant mothers. Low birth weight, preeclampsia, blood pressure issues. We know that these periodontopathogen bacteria can actually have a huge impact on these negative pregnancy outcomes. Now, kidney disease, chronic kidney disease. This has a bidirectional relationship. So they're almost like, when you have periodontal disease, when a patient has periodontal disease, it has a great impact on the kidneys and on kidney disease. Patients with chronic kidney disease have a 30 to 60% incidence of periodontal disease. And patients that have both chronic kidney disease and perio disease have a 35% increased risk of mortality compared to those without periodontal disease, or I should say unmanaged periodontal disease. Cancers. There is so much more to know about how periodontopathogen bacteria can increase cancer issues. For example, we know it's related to perio disease, but tongue cancer increases 5.23 times with each millimeter loss of alveolar bone. And that is found in Nazar's research that's listed for your easy access. Just click on the link. Periodontitis is also associated with the risk of oral, esophageal, gastric, and pancreatic cancers. The F nucleatum is also strongly related to colorectal cancers. And it's like, how the heck does that happen? We're going to talk about that too. Rheumatoid arthritis. We're going to go ahead and move here. This is, again, something very closely associated with perio disease. When a patient has perio disease, it increases the rheumatoid arthritis symptoms in these patients as well. So it's going to really lead us back to, what are we doing about it? How can we help? So patients that have both of these things, RA and PD, have a much higher level of bone loss and tooth loss, of course. P. gingivalis and AA are primary pathogens noted in the Rheumatoid Arthritis Association. Now, this is my favorite part. Local periodontal treatment may reduce the severity of arthritis. So not only is it about educating the patient and helping them to interact with their other health professionals, but we can actually have a real impact on improving their day-to-day lives so far as their comfort level and ability to interact. So patients that are at a high risk for rheumatoid arthritis have a dysfunctional autoimmune system. It's just part of the package. They also have, again, these periodontal pathogens present, such as G and AA that we talked about. It creates these certain things called citrullinated peptides that can increase tissue destruction related to perio disease. And again, just like with chronic kidney disease, these two issues are interrelated. They are bidirectional. So when you've got one, it can increase the risk and the exacerbation of the other, both ways. Now, this method of transmission of these bacteria is gut dysbiosis. So this is the third method of dissemination that we discussed earlier. Okay, so gut dysbiosis. The bacteria are all out of balance there. So when this happens, it's important for when we know patients are having rheumatoid arthritis, we see it in their history, they're having issues with it. We want to always look to what is their level of disease activity and how can we manage that disease with that patient, of course. And also, we need to make sure their health professional, their rheumatologist, is checking for gut infection because both things can be treated to lower the rheumatoid arthritis symptoms. Wow. So we're going to move from joints to the brain. Alzheimer's disease is more and more in our news so far as professionally as well as in the public. Over 47 million people are affected worldwide. This number continues to grow because our aging population is increasing exponentially every year. So, the link between these two things, perio disease and Alzheimer's disease, actually can be related to the spread of these disease bacteria from the oral cavity into the brain. And this is through the blood-brain barrier. In patients who have passed from Alzheimer's disease and have the autopsy done, there has been found 7-fold higher density of oral bacteria in that brain tissue. There's also, when there's perio disease situations going on, a 6-time increase in cognitive decline. And I do bring that up to my patients, especially my adults into older adults here. It's like, look, we need to do everything we can to help prevent this issue. And also, I read one article that said 10 years of consecutive chronic periodontitis shoots the likelihood of Alzheimer's through the roof. I mean, that's enough for me to use every trick in the book to stay healthy. But anyway, all right. So the oral bacteria most found in the central nervous system with cognitive impairment association are the spirochetes or treponema, FNPI, H. pylori, etc. P. gingivalis, again, back to PG. This is one of the key pathogens of chronic periodontitis and often is what's seen such high numbers of that in the brain of patients who have died from Alzheimer's disease. I mean, come on. We've got a lot of evidence to this now. Now, moving on from the brain to the bones. Severe osteopenia. It's bone loss associated with periodontal disease. You know, when a person has severe osteopenia or osteoporosis, when a patient has, on top of that, periodontal disease, they're at a much higher rate of bone loss and tooth loss. Just as a side on that, mostly it's postmenopausal women that are affected by it, and an estrogen deficiency can actually be the culprit also to this. So we want to look at estrogen treatments to help actually improve that situation for postmenopausal women. All right, and I mentioned earlier about gut-mediated bacterial transmission and colorectal cancer with the FN bacteria. Again, it's not something that I was aware of through neither my dental hygiene education, which, as we all know, is extremely extensive, but also in my years as a professor of dental hygiene, I had no idea that there was a relation with colorectal cancer. However, that is a fact. So again, it's something that we need to be able to bring to our patients' attention just as an educational thing. Now, one of my favorite things is there's a lot going on out there that seems out of our control. However, we do have the ability to have a positive impact on all of the things I've been discussing. The prevention of disease and management of disease can really have a huge impact on everything we just discussed. That includes oral care assessment and education, dental hygiene or dental product recommendations, therapeutic dental hygiene services, and recare strategies. So we want to start at the beginning, which is our medical dental history, because we know that there's kind of a three-way thing here. We have bacteria, we have host response, we have all of this working together. So we want to find out what's going on with their medical dental. We should get a new history every year, and we should update it effectively each appointment, because sometimes patients take it upon themselves to say, oh, she's not going to care about that heart attack because they're looking in my mouth. So it's really important that we stay updated at this and, again, help educate the patient how the head's connected to the body. The intraoral exam. I know that we're all under the clock, but this is imperative to our actual assessment of the patient. We need to make sure that we note any findings that are not within normal limits, discuss it with the patient, show areas of concern, and of course with the dentist when they are in for the exam, refer to the oral surgeon as indicated, and practice the 2-week rule. Here's something they've never noticed. Now you're going to notice it because we're showing it to you. If it's still there in 2 weeks, call us right back. Let's get you in for a biopsy. Some offices will do their own initial biopsy. Not really. Just checking the tissue before they refer the patient. So 2-week rule. And this has happened for me with one of my patients that had what looked like an innocuous 8 millimeter in circumference swelling in the palate. And I was like, I've been seeing this patient for a while, 45 years old, non-smoker. And I said, 2 weeks, you're going to go to an oral surgeon. If it's there, it was. He lost half of his palate and had an obturator, of course, placed. And, thank God that we educate our patients and that we follow through on this. So again, don't skip this. Only about 36% of offices in the United States do this on a regular routine with patients. It's a lifesaver. All right, radiographs, baseline full perio chart, getting the CAL involved, not just PD, pocket depth. There are all kinds of different methods to collect this. One, it's imperative to have current x-rays, preferably things that show bone level. So full mouth series, use at least number 2s or vertical bite wings, something that we can see the bone level, and then get that full chart. The initial baseline gets all the stuff added. The updates, perio depths are fine, okay? And bleeding, of course, if there's exudate, etc. So that needs to be collected. We cannot individualize care if we haven't done this appropriately. Then we have our patient education. I disclosed a gentleman today, all dressed up, looking great, who wasn't brushing or flossing his linguals. It was kind of a horror show, but once he saw it and was like, oh my God, it made a big difference for him. He also is a perio maintenance for understandable reasons. Hopefully he'll improve. So when we do this type of thing, it really helps determine, is the patient complying with their instructions? It also helps them actually see and realize that they have a part in this, and we get to track their progress over time. hopefully progress. We find out, are they using a manual or electric brush? And then we need to, based on how they disclose or what their condition is so far as their oral care, we need to deliver appropriate care instructions based on what they're not doing. Encourage what they're doing, but what they're not doing, we want to make sure we're doing that. Recommend what brush type and replacement intervals so that they always have the opportunity with the best products. Interproximal devices, not a lot of people floss. Find something that can work for them, whether it's the water pick or the soft picks or something that's going to help them reduce that plaque biofilm between their teeth. Help them out with proper techniques. Mouth rinses, huge. There's a lot of bacteria. Remember the 700 number? We need to make sure that patients are using what is most effective for them, that will give them the most bang for their buck and help them to manage, either maintain oral health or manage disease more appropriately. And we want a mouth rinse to be non-alcohol, kill bacteria like nobody's business, stick with that patient or be substantive, non-staining, and have an acceptable taste. There are great research articles out there that compare using different types of mouth rinses, for example, versus flossing, and comparing those things. You see study 1 and 2. There is 37.5% plaque reduction for brushing and rinsing only, and only 2.1% brushing and flossing in that particular study. You'll find that to be consistent throughout. Brushing only, obviously, is not going to reduce nearly as much plaque. Also, when a patient has perio pockets that are greater than 3 millimeters, asking them to floss is kind of not worth doing for those areas, because floss is going to reach 2 to 3 millimeters max, right? Getting them on a water floss or something that's going to help penetrate those pockets is going to make all the difference in the world. So when we use an antibacterial product, I use molecular iodine, for example, we know that just reaching is only going to reach 21% of a 6 millimeter pocket, whereas studies show that with the pick pocket that is made to go within the perio pocket, you can get up to a 90% irrigation coverage. That's a big deal. Also, when you compare the different kills of these bad bacteria, the different effectiveness of it, you're going to find over and over in all of these comparisons that molecular iodine is going to be completely effective on the bad actors, Fusobacterium nucleatum and Prevotella intermedia. That's just 2, for example. Great activity in the mouth at helping get a patient in a healthier status. So effective perio treatment, hello, if a patient needs deep scaling, do the deep scaling. Bring them back to evaluate. Get them in for regular care, because we're seeing evidence that when we keep a patient out of chronic active disease, it will have a good influence on that metabolic status. It will help to reduce glucose and A1C levels, improve kidney functions, and in the patients with type 2 diabetes. Also, again, as we referred to earlier, patients with cholesterol issues, reduces LDL and triglycerides, and can help to increase HDL. Recare management, bring them back. They can't manage themselves effectively over long periods of time. It's 3 months is the average time that's recommended to help effectively manage patients that have perio disease with a perio maintenance prophylaxis. If a patient's not responding, they're still having active bleeding, etc., please refer them to periodontitis. I did have a gentleman today, that said, I'm going to get a denture someday. Just please do what you can and watch out for that tooth. Number 30, it's just waiting to fall out. Half of that tooth is broken off. All right. So there you go. critical care dentistry, this is us, and I'm wrapping it up with this. We help to save lives. We help to improve the quality of life. And that's the entire dental team. We have incredible dentists with incredible dental hygienists and dental assistants that assist in making that a fine flowing patient care delivery system. And we really need to work together to continue really making a difference, educating those patients, getting those assessments updated on a regular basis, communicating with those patients about this so that they understand the importance of what you're doing as well as what they can do on a daily basis with their techniques, skill levels, and products that actually work for them. When we're doing this, we're lowering the disease burden of oral systemic impact. So we are hoping to foil the pathogenic pathways that this bacteria will create if it's in dysbiosis, if it's out of balance. So we can do these things through our strategizing self-care recommendations with those patients, helping them understand the importance and finding ways to make reasonable recare intervals with our interprofessional consultations and communications so that the left hand knows what the right hand's doing. And we help I talk to my doctors and nurses all the time about, are you looking at your patient's mouth and not just their tonsillar pillars in the uvular area when you're asking them to open wide? So anyway, it's really important. All of these great things we can do. We make a difference, and these periodontal pathogens are not going away, but we can help to mitigate, we can help to reduce the impact on our patients' health and make life better. Thank you very much for your time. If you have questions, please write me. I will respond to each one of you. And you see my contact information on the screen. I'm here for you anytime, and I will take any questions you may have.
I'm gonna help you with those, Pam. So let's see here. We have an interesting question here about patient communication. How do we get our patients to, hi, Dr. Stanley. How do we get our patients to understand these links? Many look at the oral cavity as separate. Very true.
When I look over their history, and when I'm working on that patient, I'm trying, with layman's terms, of course, to relate what this means for them in their overall welfare. And I talk about it. I said, you don't just have bacteria that stays in your mouth. You see this bleeding, of course, I pre-rinsed them at this point, but you see this bleeding that's going on? This means whatever bacteria is causing that infection, it's now in your bloodstream. You can inhale, and I talk about it, you can snore and choke a little bit in your sleep and inhale this into your lungs. You can swallow this and it can go to your gut and actually increase a risk of irritable bowel syndrome, even colorectal cancer, as mentioned earlier. And furthermore, I don't want dementia to you. This has been shown to cross the blood-brain barrier when chronic period disease is not managed. So, that's the kind of thing I do talk with them about it. While their mouth's full. I've got a captive audience, and it's really important that we do this.
Question here about what kind of bacteria can you get from your pets? And I started to answer a little bit because there are a lot. We can actually get MRSA from our pets. There have been cases of that. But my question back was, if you're speaking of bacteria that transmits periodontal disease and perhaps, systemic link, there are quite a few. The species aren't the same. So do you want to comment, Pam, on that at all? Or?
Well, I'm going to say something that may not have a scientific background, maybe, but
don't kiss your dog.
Don't kiss your dog. No,
right.
No French kissing, especially. And I don't know about you, but I had 2 Rottweilers, and I brushed their teeth every week. And there's even a product made of molecular iodine that you can put in that water and help those dogs not have period disease bacteria spread around.
And we'll be
there you go.
talking about that afterwards here. Exactly. Yeah. ioTech makes a molecular iodine water additive. So if you want to learn more, stay on, because it's very effective. In fact, it was more effective than veterinarians brushing the dog's teeth.
And much more cost effective.
Much more cost effective. If you've had vet bills like I've had recently, I could go get myself a Mercedes probably and enjoy it. But there are dogs are part of our family, so that's what we have to do. But prevention is good for our animals as well. But yeah, don't kiss your dogs and vice versa.
True.
Let's see. Dr. Stanley makes a good point. We need to empower people to be their own dentists, but so many people want to sit back and have it done to them.
Correct.
And then they want to blame it on us when it doesn't work. So, all right, let me go on down here. Comment from Dr. Nishimoto. My mother had rheumatoid arthritis. I prescribed her minocycline, low dose. In those days, it was an accepted regimen. She told me that it helped her more than her meds that were given to her by her physician. And also she went on to say, it sounds like you can say a clean mouth is a clean bill of health. Alice would say, I understand what people with AD have, P. gingivalis in high amounts, but what do people with cardiovascular diagnosis seem to have greater amounts of?
Well, again, you're going to have a lot of PG. You have the fusive bacterionucleatome, AA. I wish I could go back to my slide. My slide has actually listed the predominant periodontal pathogens that are found in atherosclerotic plaque. So that is in your handout and easily accessible there.
Is it true that swimmers have less periodontal disease due to the chlorine in the water? I don't swim with my mouth open, but
me either,
because I'm worried about whatever else is in the water. So risk versus benefits here, okay?
Yes, I am unaware of that being a fact.
I am too. I think there was at one point there was a concern that swimmers actually had more enamel breakdown because of the chlorine in the water as well. So, but I don't know. I don't have the data in front of me. I just recall reading that somewhere. Cassie states, I'm so surprised that brushing and rinsing reduces plaque more effectively than brushing and flossing. Thanks for the inspiration. We do help to save lives and improve quality of life. Go teams. Doris, we coexist with microbes. Yes. And sometimes it's a good existence, Doris, and sometimes it's not too good. Thank you, Pam. And let's see, we have quite a few other comments here, and we've got a couple more minutes. What percentage of the effective irrigation using a water flosser for a perio pocket? I know you mentioned rinsing.
Love that. Yes. Remember when we're using, let's say, and I say water pick because that's what my husband uses. But anyway, when we use a water pick with a traditional tip, we're entering perpendicular to the sulcus, correct? So with a perio pick, that is a specifically designed tip that will deliver that irrigant into the perio pocket safely. That's the important thing. So it goes from 21% with rinsing or using regular, but when we use the pick pocket, that gives us up to 90% access to that pocket. That's huge. So, and I do have patients that have 6 millimeter pockets that aren't going anywhere. You know, they're going to let a supervised neglect situation go on, but you know, you either don't see them or you do what you can for them. And that's one of the things that I do. I said, use your molecular iodine in this reservoir and your pick pocket and help make a difference, because your other areas that I would recommend, if they didn't have deep perio, would not be as effective for them.
There's a comment here. I have an iodine allergy. Is there a substitute you'd recommend for those with iodine allergies? So if you stay on and learn about molecular iodine, you'll find out that's probably a non-issue for you with molecular iodine. So I would recommend, again, if you all have a few minutes, stay on and hear about ioTech's molecular iodine oral care products. I think you're going to be amazed if you don't know about them. If you do, it's a great, there are great new products that are coming out. How do I get my dentist on board for water flowers stuck on flossing? Just tell them to get out of the way for a minute.
Really, you are the oral preventive specialist and oral therapeutic specialist. So nobody dictates what the dental hygienist is educating the patient with. That's the whole point of being a degreed licensed oral healthcare professional.
Sure. I mean, there are other tools available that might work differently in someone else's hands. So, you know, as a dentist myself, I just got out of the way. I mean, that's why I hired all of you. That's why I wanted you in there, because I needed you to be my eyes and ears too, and provide the patients with what I wasn't able to do.
Exactly. And if we're stuck on floss, there are too many people that will not use it. So when we look at all these other really amazing alternatives that we have today, that's where we need to find the best fit for that patient. Not just for me, but for that patient.
Okay, Pam, what I want you to do, you and your husband, is come up with a song, a Lionel Richie song called Stuck on Floss.
Oh, we've got it.
You can do that.
I do that song already. Thank you.
Do you? You do? I love that song. So Stuck on Floss. Stuck on Floss. Yeah. Christina, will these other courses be presented by Pam, and will they be online? Connecting the Dots, Making Sense of Nutrition. I'm not sure which courses those are.
That I could come forward with the Making Sense of Nutrition. I have a whole.
On your website. Yes.
Yeah, on my
we'll
website.
talk, Pam. We'll talk. Yeah.
And thank you for that question.
Yes, that's great. Do you have a brand of molecular iodine? We sure do. It's ioTech. It's coming up here in just a second. And I think for those of you asking about CE codes, please make sure you tap on that banner at the top of the screen, get your CE credit instructions. There is no code. You can log out. You'll be taken to the quiz. We're going to email it at 7 o'clock Pacific time. Please don't contact the website, Where's My CE Credit, because I'll be taking extra blood pressure medication tonight, and I really don't want to do that. I'm going to make sure you get everything you need. So, but we hope that you'll stay on and learn more about molecular iodine, because this is why we're all here too. It's a tool that you can use in your armamentarium to treat your patients. So with that, I'm going to bring up Angelique's presentation here. And there she is. And we're going to start. Pam is going to talk about her experience, how she became familiar with ioTech International's molecular iodine. And then I'm going to introduce you all to Angelique Adderley, who runs the show there. And she is going to talk to you about the products. And stay on, because you're going to have an opportunity to get free samples and learn more. So please stay on if you can, and I will be quiet and be in the background.
All right. So I am really excited about this wonderful product. I actually met molecular iodine, in this case, ioRinse, back in 2020 when COVID hit our world. And my dentist, you know, we're all like scrambling, trying to do the very best we can at helping to combat this virus. So he found the molecular iodine, ioRinse, and started using it as a pre-rinse because it's so hugely effective. And Angelique will talk about that on the COVID virus, for example, as well as tons of bacteria. So I was like, wow, well, this is really interesting. And so I started researching it, because that's what I do, is I love to research. And I found that it had so many great aspects. It did not stain my patient's teeth, cause more buildup for me to have to remove within a month after they started using it. It was really helpful to helping them not be bleeding every time I saw them. It just made a difference. So that's where it all began. Well, I am one of those who likes to use what I can to try products out, as well as assign it to patients that have a greater need because what I'm doing is not working with them, and what they're doing at home is not working. So I had two experiences. One just happened, and one happened last year. I actually was on vacation with my family. I did not have iorinse with me on my vacation. And I have an implant, number 30, that started bleeding, acute bleeding. And I mean, I'm a flosser, and girl, I can brush my teeth. I'm great at plaque reduction. And yet I could not resolve it. Could not. And I'm like, this is an implant, $5,000 tooth. I got home a couple days after this started and started using my iorinse, swish, 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 swish. I'm talking morning and night. The peri-implantitis went away. That's the first thing. And I said, okay, I'm sold. Well, January this year, I came down with COVID. And yes, I get my boosters, I do all that. Hello, it's everywhere. So I'm so sick. I don't want to get out of bed. I'm brushing once a day because that's the best I could manage. I mean, I'd get out of bed, brush my teeth, wash my face, I'd get back to bed. I rinsed with iorinse every day because I just wasn't up to anything else. A week later, because I was a 6 days of positive testing, on the 7th day, I finally tested negative, and I flossed. I felt more energetic. I was ready, and I did not bleed. I'm one of those people that without the iorinse within 2 days, I'm bleeding again. It's just my immune system, etc., my chronic conditions, all of that. So anyway, I am a big supporter of iorinse. Now, I have a patient that has come in to me, type 1 diabetic, insulin pump, has had pneumonia 6 times in this last year. Guess what she's using now? She immediately got her new electric toothbrush that I went over with her how to use. She's using a water pick, and she's using her iorinse, the concentrate in the water pick. She used a cap's full of the solution to a reservoir full of water, and she's able to really help manage her condition. Now I'm going to check and pray to God she hasn't had pneumonia again. I don't expect she will because it's so effective at killing bacteria. So those are my testimonies, personal experience that I've had from 2020 to January of this year. Angelique, take it away, girl. You know everything there is to know about it. Thank you.
Thank you so much, Pam. That was an absolutely wonderful presentation, as always. We truly appreciate you. My name is Angelique, and I am with ioTech International, and we do have a line of molecular iodine products. Many products that Pam was able to, she talked about in her webinar. And we also have a webinar by Dr. Moskowitz through the Dental CE Academy that goes much more in depth about the technology behind these oral rinses and molecular iodine products. And his next webinar is on the 20th of March at 6 p.m. Pacific, just in case you are interested in learning more about the iodine technology. So, okay, time for the products. So first up on our top left, we have iorinse Ultra. Now, iorinse Ultra is our first OTC product. It's our first OTC drug, which allows us to make our anti-gingivitis, anti-plaque claims. It has the same level of molecular iodine as our iorinse ready to use. Many of you may be familiar with the ready to use formulation. Both of these are equally effective in with their levels of molecular iodine. They do not need to be diluted for use. Both can be used pre-procedurally, and both can be used long-term for ongoing daily at-home rinsing for your patients. The iorinse Ultra is available in a soft mint flavor. It's available in 1 liter size or a 16-ounce size. The 1 liter comes in 12 1-liter bottles per case. The 16-ounce is 24 bottles per case. Now, the iorinse RTU is available in green apple and soft mint flavor. The soft mint flavor also contains xylitol. So I know some people may be interested in xylitol products. So the soft mint ready to use does contain xylitol. These products are also available in 1 liter and 16-ounce sizes, 12 1-liter bottles per case, 24 16-ounce bottles per case. Next, we have our iorinse concentrated arrogant. Now, this is the product that you would want your patients to use in their water pick or their water flossers at home. They would simply add 1 capful to the tank of their water pick and then continue filling it with just regular water. This is great for getting down into the pockets. It's great additive for your daily water flossing, and we've had tremendous results. There's no risk of staining with these products. The concentrated arrogant, even though it is a darker solution, it is diluted for use. So there's no risk of staining with ongoing long-term use. The iorinse concentrated arrogant is available in a green apple flavor, and there are 12 1-liter bottles per case. Next, we have our ioGel tray gel. Now, ioGel is a thicker formulation of the molecular iodine. This can be used with a periodontal tray for at-home use. So the patient would dispense a small amount into the tray, place the tray into their mouth for about 5 minutes. They would leave it in place, and then they would spit out the excess. This allows the gel to penetrate deeper into the gums along with the pressure of the trays, and it's a great product for at-home treatments. This comes in a 12-ounce bottle with 12 bottles per case. At the bottom left, we have ioCleanse. Now, ioCleanse is our hand cleanser. This is a molecular iodine product that simply needs to be sprayed onto your hands. It has all the powers of molecular iodine, can be used on your skin safely, no staining and no drying. This does not contain alcohol, so you don't have to worry about drying of your hands. You simply spray it on, allow the product to dry. This comes in a 1-liter size bottle, 12 bottles per case, and it also includes a spray head that can be attached directly to the bottle. Next, we have our ioMist, which is one of 2 nasal products that we do have. ioMist is a saline nasal spray. It also contains some molecular iodine. This is a 1-ounce bottle, and it comes in a spray, like a nasal mister bottle. So this is not something that you would use with multiple patients. This is something for individual use. For that reason, in office, we recommend our ioShield nasal cream. So the ioShield is a much more cost-effective way to protect patients during procedures and to protect the office as well. ioMist comes in 24 bottles per case. The ioShield comes in a 2-ounce jar. There are 9 jars per case, but this breaks down to only a few cents per patient if used pre-procedurally in the office. You would simply swab a small amount inside the nostrils, pinch the nostril lightly, and this gives a physical barrier as well as the molecular iodine barrier in the nasal passages during your procedures. Last up, we have our first pet product. So as discussed when with Dr. Rowling and Pam with kissing your dogs, we want our pets to have a nice clean mouth as well. So, and also fresh breath and healthy gums and teeth. So ioVet Oral is our first pet product. It is a pet water additive. So you simply dispense a small amount into the pet's drinking water 1 time per day. This can be used for dogs and cats. And even if they share a water bowl, the liquid is measured according to the size of the bowl. So you just simply dispense a small amount into the bowl once per day, and it is more effective than daily at-home brushing or veterinary brushing of the dog or cat's teeth.
Hey,
And
very
there's
quickly,
also-
Angelique, I'm sorry. I want to remind folks too, because I forgot to tell them, there is a banner at the top of the screen that will take you right to ioTech's landing page, and you can get free samples and sign up for lunch and learns and so forth. So be sure you go to that blue banner, bookmark it if it's information you want to take back to your practices tomorrow. But there's an ability to get free samples, learn more. All right, Angelique, I'm out of here again.
Thank you, Dr. Rowling, as always. Yes, definitely click on that banner. We will provide any information that you need. We do have samples of our products. We also have informational sessions that you can sign up for and have your office sign up for. So please click that banner, fill out a quick form, and we will definitely reach out to you. And as for the pet water additive, it comes in a 4-ounce bottle. Includes a dispensing syringe, and there are 18 bottles per case. Now, all of these products are available through our website at iotechinternational.com. We do have a professional store which offers wholesale pricing. That's the case quantity pricing for dental professionals. You can also have your patients order. If you do not stock products, your patients can order through the consumer portal, which is individual bottles at retail pricing. But there's no prescription necessary. This is not available in stores. It is available through dental distributors as well as on Amazon and through our website. I also want to mention, if you are an office that stocks product and you want to buy in bulk, we do have additional discounts on bulk ordering. So if you order 10 cases or more of any products, we do have an additional 15% discount on those. So if you are interested in ordering in bulk, just please contact our office and we can help you with that additional discount. This is the link as well that Dr. Rowling just mentioned. We have patient brochures that are available free of charge to you. You can just request them through our office. You can also request them through this link. And we also do informational sessions. So we will do a virtual office learn with your office to provide more information about our products, about the use of our products in office, as well as for at home for your patients. And we will provide brochures, literature, and samples that you can get introduced to the product, try it out. And whenever we have promotions going on, you'll definitely be aware of any promotions that we do have. In 2018, iorinse ready to use and the iorinse concentrated irrigant were evaluated by clinicians' report. They did this evaluation with 250 patients. 125 of those patients used the concentrated irrigant in their water pick. 125 patients used the ready-to-use formulation. The patients were taken from 50 offices, 5 patients per office. And this was just an overall rating that we got as a result of that evaluation. Because of that, in 2019, Clinicians Report listed our products in their buying guide as a best product for 2019. We were again listed as a best product for 2022. This was following the article that was written in April of the April newsletter of 2021. And we are again listed as best products for 2023. And we just found out about for 2024. So this is something we're very proud of and something that we strive to keep going. You can also learn a lot more about this article that was written, the study that was done through Clinicians Report in Dr. Moskowitz's webinar. This is also through the Dental CE Academy, and the next live webinar is going to be on March 20th. Here are just a few of many key opinion leaders that also recommend the ioTech products. These articles are available from us. If you are interested in reading any of them, we can send them to you through an email, or you just reach out to us and we can get you access to any of the articles that have been written and anything that has been said by key opinion leaders. Now, this is just a quick illustration of projected profits per practice. Now, I do know that some practices do stock product for sale to their customers, and this is, to your patients, and this is why we provide the products at wholesale pricing for you. This leaves it wide open for you to be able to make a profit through the sale of these products. And we also have a program that if you do not stock product, you can earn commissions on the sale of your products when your patients buy through our consumer store. This is also information that you can get by clicking that link at the top of the screen, and we can give you more information about the brand ambassador program as well. As far as an economic comparison of oral rinses, even though molecular iodine is great for ongoing long-term use and has all the great effects provided, it is still one of the most economic choices that you can use for your office and for your patients. And this is just our chart with for product availability. All of our products are available through ioTechInternational.com. We would love to answer any questions that you may have. Our telephone number is on the screen. We're available Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time. So if you have questions about pricing or about any programs that we have, you can please give us a call and we will be able to answer those questions, or simply fill out the form by scanning that QR code or clicking the link at the top of the screen. And you can leave a message for us there as well, and we'll be happy to reach out. We will have our office reach out to you, send you out a sample, and see if there's anything else that we can do to help you out with any purchases or answering any questions for your patients that you may have or your patients may have. Okay, so I'm going to look back and see if there's any questions that I may be able to answer. And I will look forward to hearing from you. I thank everybody for staying on for this portion of the webinar.
Yeah. Do you see Heather's comment there? Okay, you all asking about where the quiz is. You can just log out and be redirected, or it will be sent to you in about 10 minutes. All right. Question about how much iRinse do you add to the water pick container of water?
So water pick canister holds about 300 milliliters. So you would add one capful, which is a 30 milliliter capful, and then continue filling up. So it's about 30 milliliters of iRinse concentrated irrigant, 270 of plain water. Great.
And again, I want to remind folks to go to the banner at the top of the screen, and you can order samples if you'd like. You can take advantage of learning sessions with ioTech and other promotions. So if you go to the page, bookmark it to your device, take it back to your practices. You also have this presentation in your course folder, so the link is there for you as well. There's a comment here from Heather. We've been using iRinse for a few years now as a pre-procedural rinse at our office. We noticed it's helped with reducing the bacterial load as well and helping with perio. Excellent.
Thank you, Heather. And we do have more products that are about to be launched, and we can provide information on that. And in fact, Dr. Moskowitz is going to be doing a few new webinars on those new products as well.
He'll be presenting in about a week and a half on perioimplantitis. I'll be presenting in a couple of weeks on oral mucositis. And we'll be talking about products that are essential for treating those, as well as others. So be sure you go to the website, and definitely our presentation on oral rinses, what's safe, what's effective. Dr. Moskowitz will give you the entire breakdown of all of the antimicrobials that we have available. And you'll see that molecular iodine comes out the winner on all of those with evidence-based research. There is a question about, is there something over the counter that has molecular iodine in it? And I know that was probably posted before. And yes, reach out to ioTech, and Angelique will be excited to tell you all about it, or Jason.
Yes. Yes, and the products are not no prescription necessary, so they can be purchased through, if you're looking for patients purchasing, they can purchase through our consumer store, which does not require login. Our professional store does require you to create an account to order bulk at a bulk wholesale rate. But yes, they can purchase through our consumer store, or they can also be purchased on Amazon.
Question or a comment and a question from Dr. Locke. She's a dentist. She works in a long-term residential facilities, which I did as well. How can my patients access the rinse? What they use has to be prescribed and available at a pharmacy.
Currently, we don't require a prescription, so we don't have it available through pharmacies. They can check with their dentist. I'm not sure if that would qualify for it, but you can reach out to us and we can help you out with that, figuring out what necessary steps are needed for that.
And Erica, you're director of nursing at your facility. Also, once you determine the patients that would benefit, could probably help, get the ball in motion to reorder and whoever handles their finances. So if there's a power of attorney or family member or whatever too. There's a couple of questions here in moderated. Let's go ahead and take a chat. Iodine allergy, can you use molecular iodine? Yes. If you're worried, you can test it on the wrist a little bit. It's a different form of, it's iodine, not iodide, and many patients are allergic actually sometimes to seafood, and there's a concern, but that's really the muscle protein in the shellfish, tropomyosin. So molecular iodine is a little different formulation, and you shouldn't have an issue. Any other questions here for Angelique? What is the shelf life? How is it degraded? What are the metabolites?
So the shelf life is 2 years, and as long as the bottle is kept tightly closed, it can last even longer than that. As long as the liquid has an amber color, you know that the molecular iodine is present, and the only way that usually escapes is if the bottle's left open so that the iodine can escape into the air.
Question from Maria, is this safe for dogs to swallow?
Yes. When it's added to their drinking water, it's added in nutritional quantities. So for them to ingest it is not a problem for them. And the ioVet does not contain any xylitol. That's only in our human ready-to-use formulations. So yes, it is safe for them to swallow. And
even in humans, iodine is an essential part of our nutritional panel. So you have to, sometimes you'll see iodized salt. I know areas of Pennsylvania where I grew up, there are folks that didn't get enough iodine. They end up with thyroid issues. So iodine's essential for your diet. And there have been studies where they've fed people iodine to look at breast cancer prevention and so forth. In Japan is a very famous study. So question here from Sid, my dogs drink a lot of water here in Texas. Should you use less if they drink a ton of water a day? I would control it. So if you have a separate little bowl with the iodine that you can be sure they drink it, and then the rest of the day, I think they would be okay. That's how I would approach it. So you'd know that they got the essential quality or quantity, excuse me. Tara's asking if it's non-staining. Yes. So that's another benefit. Any issues with using post-surgical procedures? No, in fact, there's indication that it's actually very beneficial post-operatively. So for instance, implants where you would not want to use chlorhexidine gluconate, molecular iodine is very beneficial post-surgically for extractions, etc. Definitely post-operatively for your quadrant scaling and root planing patients as an irrigant as well. Any other questions or comments? Angelique, did we reach the end of the internet this evening?
I think we have.
I think you were so comprehensive. Yeah. So let me double check here. Even the dog rinse is not available in the store. The dog rinse is actually available through some veterinary distributors online. Yes. You can also get it through ioTech website. And if you tap on the banner at the top of the screen, you might even find yourself with a sample. So I would go ahead and enter your information. It is on Amazon too, but if you reach out to ioTech directly as well, they're going to let you know about various offers and so forth. So it's good to register your practice with ioTech if you can. Anything else you want to add, Angelique, before we thank everybody for being here tonight?
I think we did great. I love the questions, and I really do appreciate you all staying on to hear about the products. And we look forward to providing you samples. We look forward to seeing you guys at some upcoming shows, because we are going to be at the Hinman meeting that's coming up, and a few more shows that are going to be held this year. And Dr. Moskowitz will be speaking at some of them as well.
Terrific. Well, thank you everyone for being here. We thank Pam for the great presentation as well, and ioTech for the educational support. We're going to go ahead now, and thank you, Angelique, so much.
Thank you, Dr. Rowling.
Thanks, Pam. So we are going to close out now. You'll be redirected to a screen to complete a quiz for CE credit. You may be on a device, there may be a pop-up blocker, and you're not redirected. Don't sweat it. The email is going to be sent to you here. You should receive it within the next 5 or 10 minutes to take the quiz. All right, it's being sent from noreply@clickmeeting.com. That is the same sender as the confirmation email you received when you first joined the presentation this evening. For those of you watching the recording later, all you need to do is scroll below this video player to the instructions section. Number 2 is the handout, the course folder, and number 3 is your quiz access. So again, thank you all for being here today. Look forward to seeing you again. Bye now.
Have a good night.
Bye.
Bye-bye.